You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know about getting your children in for early orthodontic treatment, and of course, adult orthodontics, which is turned out to be a very popular procedure, and teen Invisalign is hot right now. Well, with us, we have San Diego's orthodontist, Dr. Alexander. Dr. Alexander, welcome to the program.
Thank you very much. It's a pleasure to be here.
Now, before we get into today's topic, for people that don't know you, tell me a little bit about your practice and, who's your typical patient?
Okay, it can be anybody from a very young age, as early as 4 years old, and there's a big group of them that are like between 4 and 10 that we count as early treatment. And there's another group between 10 and 14 that's more of a typical age for full or comprehensive treatment. And then we have a number of adults. I'd say probably a third of the practice is made up of adults that are undergoing either braces or some kind of
What are the age
treatment.
ranges adults are coming in for orthodontics? Like, what's the oldest patient you ever had?
Well, I had a gentleman who was like 86.
Is that for orthodontics?
Yes. He had
Why
one
would
tooth.
they want to do that at 86?
In his perception, he didn't like a tooth going out of place. He had one lower front tooth that's moving back toward his tongue. He didn't like it. He said, I want to do something about it. And his dentist called me and said, Randy, do you want to look at this guy and see if you can do something for him? I said, well, sure. Sent him over, and he was a really nice old guy. He said, I want this tooth straight.
Okay.
I said, okay, I can make you a retainer with a little spring, a little wire in behind that tooth. We'll push it forward a little bit. If you wear it faithfully, it'll get straight. He says,
now, 70,
let's do it.
80-year-olds?
No, he was 86.
Okay, but do you have 70-year-olds? Because that's young in San Diego.
Yes, I had one memorable patient was this nice little French lady. She was 72, and all her life she thought she looked good and had a nice smile. She took care of herself. She didn't look anywhere near 72, Randy.
Okay.
So she came in and she said, I hate this space between my two front teeth. I said, well, how long has it been there? She said, it just started in the last few years. Prior to that, it wasn't there. And what happened is she had one lower front tooth that had gotten really crowded forward, and then it started hitting on the upper tooth, and it knocked it outward a little bit, and a space developed. And to her, that was just unacceptable.
Okay.
So she said, you got to do something for me. I said, well, I think what we're going to have to do is we can keep the treatment in the lower set of teeth only if we take out this one tooth, which is not a typical procedure, but in her case, it was appropriate.
Okay.
And we'll close the space, we'll draw them in, and if we have to do something at the top, we'll just use a little retainer and pull them in a little bit, but it may just resolve itself in the top. And that's exactly what happened, and she was thrilled.
Okay, good.
We took that one tooth out, closed up the space down there, made them into a position where they weren't hitting the top teeth, and the top teeth looked good, and there she was really happy.
Okay, good. We've talked a lot about orthodontics, and you explained to me it's more than orthodontics. It's about having the smile you've always wanted. How important do you think the smile is? And of course,
well,
you think it's important because you're an orthodontist, right?
Yeah, that's like asking the Pope if it's good to be Catholic. I mean,
okay.
Yeah, I think it's really great to have a nice smile. In fact, if you Google on the internet value of a smile, you'll see a number of cute poems about how great a smile is and how it can affect somebody and make other people happy around you if you share it with them. But there's also been a number of published articles in some of the popular magazines, such as Women's Day and Men's Fitness, where they've published studies regarding what makes a member of the opposite sex attractive to someone. And they've ranked different characteristics, and always in the top 3,
teeth.
Smile. Smile was in there. We had somebody with a nice smile. Eyes are nice too, but a smile was right in there. So it's very important to a lot of people in their perception of how they look to themselves and how other people see them and how they think other people see them. So if you go by that, it's a huge factor.
So do you ever have patients that, and obviously you're an orthodontist, so you're around this all the time, but even when you are surprised?
Yeah, absolutely, Randy.
With how they react with straight teeth.
Yes. One of my favorite stories was a young girl who came in for an exam, and she walked in, she was holding her hand in front of her mouth like this. I said, wow, and I thought it was just temporary, but she did it every time she started to speak. So sure enough.
Even at the dentist office?
At the office, yeah, when she's in a dental facility. So I asked her if I could look at her teeth, and she sat in a chair and she smiled, and it was like teeth were everywhere. I said, wow, we got to work on this girl and straighten her out. So there was enough crowding and malpositioned teeth, we had to take some teeth out. So we started treating her, got the teeth out, we're starting to straighten things out, and about 8 months went by, and it was quite a change. She looked a lot better, and she went to visit, I think it was an aunt or a grandmother who hadn't seen her since we started treatment. And she said to her, I understand you're getting braces now, let me see what's going on. And the girl pulled her hand down and smiled and said, oh my gosh, that looks terrific. You look so much prettier and better now. From then on, the next time the girl came to the appointment, she's like, hi, Dr. Alexander. It was great because it totally changed her life. She didn't feel so self-conscious about how her teeth were positioned. And just
Are there a lot of people that don't like their smile? I mean, obviously they're going to confide in you? I mean, do you hear it a lot?
Well, yeah, there are a number of people who don't like their smiles and they want to do something about it. I mean, if somebody has a smile that's not the greatest to other people, but to them it's fine and they're happy, that's great.
Okay.
However, if somebody has what they perceive as a smile that could be improved and they're willing to do it, braces are a wonderful option.
Okay, you like braces, obviously.
Absolutely.
That's all you do.
That's a terrific thing to do.
Because not everybody has the money to spend on veneers. You know, $30,000 or
No,
$40,000.
yeah, another option, if you want your teeth to look a little nicer and straighter and all, usually we'd say if the bite is good, the teeth fit correctly, and you just have to like make them better color or make them look straighter, veneers are an option. However, it's not inexpensive to do that procedure because if you go to a good cosmetic dentist, you're probably looking at anywhere from $20,000 to $50,000 or more to get everything veneered. Plus, and the worst thing about it to a dentist is if the teeth look nice and they're in good shape, you don't want to have to cut some of the tooth structure away. Once it's cut away, it's gone. So to put a veneer on properly, you have to reduce the size of the tooth. So you cut it back some, and then a veneer means you're putting a facing or a fronting on the front of the tooth to change its appearance and position. And the tooth changed forever. I mean, it may look nicer.
You have a story, you say somebody was at Starbucks or whatever.
Oh yeah, that was another incident in my life. My wife and I were at breakfast down in La Jolla, and the server was a really attractive girl, but she smiled at us when she came over, and she had this one upper left corner tooth, cuspid or whatever, was hanging out kind of. And I said, wow, she's a pretty girl. I wish I could straighten her out. But you don't want to say, wow, those teeth look horrible. You got to come in and see me.
Yeah.
So we talked to her a little bit, and she was friendly with us, and she was a nice girl. So on the tip tray, I left my card on the back. I made a little note, and I said, you know, here's another tip. You're a really attractive girl. I really love it if you'd come in and let me straighten out your teeth.
Just one tooth out of place.
Well, that's what it looked like because I didn't like pull her mouth open. I really look at her.
Okay.
So with her, we came up with a treatment plan. We could straighten her teeth, make her look prettier, and it worked out great. Everything was really nice. She loved her smile. She was very happy. I didn't realize how happy she was, though, until years later. At the time, I was working part-time in Long Beach, and she had moved from San Diego up to L.A. I get a message from the front desk that there's some lady here to see you that she says she was one of your former patients. She wanted to talk to you a second.
Long Beach.
Yeah, this is in Long Beach now.
Okay.
So I'm going, well, who is it? And she told me the name. I remembered her. And so I finished the patient. I went out to say hi. She said, Dr. Alexander, I just had to find you and tell you personally how much I appreciate what you did for me. Because that tooth,
nice.
Her smile was really bothering her. She said, I'm now so proud of my smile and let me apply for a job in public relations. So I'm not sure I would have been hired for before the way my teeth were. And I've been very happy, and I always think about how great it was you straightened my teeth. So I wanted to make an effort to drive down and personally thank you.
That is very nice. So she looked you up. So really it's a boost to the self-esteem. More than
a lot of people, it holds them back. If they're not happy to smile and they resist smiling and they really try to fake it like,
Do you see these people in San Diego walking around?
Absolutely.
Like you could tell when somebody's hiding their teeth?
Absolutely. But you don't see them when they smile. I've had patients that never show their teeth when they smile until after they're nice and straightened out, and then it's a whole other ballgame.
Okay, let's talk about kids, because at the top of the show, obviously there's different categories of orthodontic patients.
Absolutely.
You see. We've been talking about the
ages.
adults, but there's a lot of things parents need to know about orthodontics that you kind of gave me the inside scoop on a little bit.
Okay.
Because I have an 11-year-old,
Yeah.
and you made me realize I got to get him in there at least evaluated. So let's start there with kids.
Okay.
What do parents need to know? At what age should they get possibly evaluated? And how soon can you get orthodontics?
Well, let's talk about the history of orthodontic care. In the old days, like in the pre-70s, let's say, traditionally it was wait till all the baby teeth are gone and see what you have and straighten them out. However, a lot of those people had conditions that reverted. We call it relapse. The bite changed again later and went back to a really unfavorable situation. So orthodontists got smarter and said, what can we do to avoid that? So during the 70s and 80s, what became popular is the idea of doing earlier treatment, make room for the teeth, so instead of them coming in way out of place, they grow in where they belong. Now, how great is that? If a tooth grows in where it belongs, that's where it's staying. It's home.
But it has to be the permanent teeth, right? I mean, you can't start orthodontic treatment until you have the permanent teeth, right?
No, wrong.
Is that right?
Yeah, we've had cases as early as 4 years old where the patient presents with what we call a crossbite, Randy. I don't know if you know what that is, but
what is
crossbite's like in the front, We call it anterior crossbite, and the lower front teeth are biting in front of the upper front teeth. That's a really bad condition.
Is an underbite a crossbite by any chance? Or no?
That's one form of a crossbite. That's
Okay.
an anterior crossbite with lower jaws forward. We kind of typically call that underbite.
Okay.
There's also a situation where the back teeth fit in the opposite pattern, so that instead of the top teeth being out to the cheek side of the lower teeth, it gets kind of tangled, but they're biting into the inside or middle
So
of
it's
the
just
bottom
off. The teeth are off.
Yeah, so the sides don't match correctly. So the nice thing about getting that corrected is it
Like
helps.
early, like 5 and 6 years
Yeah,
old?
we had even 4-year-olds do it because it's really great because it helps the jaw joint on the opposite side of the person's head function in a much better pattern where they don't have problems
So they
later.
grow correctly, you're
They
saying?
grow correctly.
But
the
these
jaw's
aren't actual wires and braces, are they? Or is it more of a guard, a night guard?
It's a type of device. A typical one is called a palate expander. It means you're making the upper jaw wider. There's a growth area down the middle of the roof of the mouth that we can open up, push the two sides out, and everything works great. And a nice side benefit of that is as you do that procedure, there's a lot more room in the front of the mouth so that the front teeth can grow in straighter too. So it's like a double.
Is it because the
benefit.
parents just don't see it? I mean, visually they think there's no problem. They wait until they're, I guess when they're 16 now, that's obvious that. And is it driven by the kids or the parents?
Both. Sometimes the kids say, I don't want braces, and they just postpone it and don't follow up on it. Other times the parents think, oh, they look pretty good. They have a nice smile. But it's not just how straight the teeth are, Randy. Another big reason for getting orthodontic care is because the bite is off. The teeth don't fit correctly when the mouth is closed.
And that sets them up for later problems.
Yes. One of the biggest issues I've seen with that is if the lower jaw is back too far and they typically have to push their lower jaw way out to bite into something, it strains the components, the parts in your jaw joints. And a lot of those people will develop what we call TMJ symptoms later.
Okay.
Their jaw joints start hurting and bothering them, noises and things can happen.
You brought photos.
I have some photos.
Let's start with the kids. Can we start with the kids?
Let's start with kids. So here's one. We're talking about that crossbite situation. This young girl came in, cute little girl. However, when she closed her mouth, her lower teeth closed in front of the upper teeth. And that's a big problem, Randy.
Like an underbite.
An underbite.
Okay.
If we let that persist, what happens is the lower jaw will actually develop more than dictated by the genetic pattern. In other words, she's going to have that lower jaw come out farther.
Interesting.
Farther than it should from the genetics alone. So it's called a functional shift, and it just causes big problems later, and you may need jaw surgery.
So that looks like a little girl. I mean, young.
It's a little girl, but when she's biting like that, we wanted to change that for her so she didn't have that extra development of the lower jaw. So we corrected her anterior crossbite, and that's all she needed.
Now this after, what it's just, so it's...
Yeah, the parents thought that she looked so good with just what we did with that early treatment that was her treatment she got, and she was fine.
If they wait, though, talking to parents, okay, so you know your children's teeth, they have an overbite, underbite. What happens if they do nothing and wait until they're 16, 17?
Some of those situations, you don't have growth to help you get the desired result. Some of the situations call for surgery to get the jaws matching properly.
Okay.
So if we can avoid that, most people are very in favor of avoiding surgery if they can.
All right.
If they really need it, great, but if you can avoid it through treatment done at a proper time, that's even better.
Okay, good. Okay, so what else?
So here we have a gentleman, a young man that came in. He had kind of an anterior crossbite too, and he had one upper front tooth in behind the lower. And we did some early treatment and got that corrected. And later on, he went into full treatment, and he had a nice result. And you can just see how he's happy with his smile. He's got the big beaming smile now.
Good-looking kid.
Yeah, good-looking kid. And the smile
So again, early. Would
Early-
you say he's out by the time he's like his junior year in high school? He's out of braces.
Oh, before that. Yeah, typically the ideal time to get most of the kids is like 12 to 14.
12
get
to
them in
14.
their middle school or whatever it's called, or they're in.
And then by the time they get into high school,
by high school, it's all behind them. They've got this nice smile to go through the
and
years.
then they just wear
their formative years.
like a
retainers at night.
retainer at night. Are they? Have the retainers changed? I mean, they're just like Invisalign. Are they just?
Well,
are
there are
they
different
plastic?
different styles of retainers. You can have one that's fixed on the inside of the teeth that you don't really notice. You can have one that's removable, that's part plastic and part wire. They do have a wire in front. Those are really good though because you can modify things. You can add springs and you can do things more so than the other types. And then you can have the Invisalign style, like a plastic tray that covers the teeth. The problem with those is if you're not used to wearing those and you bite on them a lot, you can actually change your bite so that you start hitting harder in the front teeth and not as much in the back because you're biting in the plastic all the time and it actually moves the back teeth.
Do you think these kids, when it's all done, do you, obviously you don't have proof of this, but do you think they're smiling more because they have nice teeth? And do you think that maybe makes them for a happier kid?
Absolutely. I'm just saying my own life. When I was 10 years old, I was playing dodgeball. I dodged a throw and I smacked my teeth on a table in this basement of the church where we were playing. And I was kind of a tough kid, so I picked up the piece and I went home and I said, "Grandma, what kind of glue do we use?" And I rattled them on the table. And she, "Ah!" She screamed at it. But I went a long time. That was before we had bonding. You know what bonding is, Randy? Where you add the two-color material.
So you didn't like your smile for a long time?
Well, I held it back for a long time because I had these jagged teeth right in front. So finally, when I was about 18, my dentist tried to help me out with some temporary caps and stuff. But I kept knocking him off playing sports and stuff. And he said, "Oh, I guess we'll just wait." So I had to do permanent caps when I was 18. For a lot of years, I had broken front teeth.
Do you feel like do you feel like you're improving people's lives?
Absolutely. Absolutely. Another patient, we have photos of him in here.
Let's take a look. Let's take a look
at him. This young man was over at UCSD, and he came in, he was an actor, and he had an anterior crossbite. Talking about that again, just remember that's the lower teeth in front of the upper teeth. He had a lot of crowding, and he said, "Gosh, I've been to several orthodontists, and they all do surgery on me. Is there anything you can do?"
Was he self-conscious about his smile?
Absolutely. He didn't like it at all. He wanted to improve. He said, "I'm
Did
on
he not
stage."
smile because of it?
He kind of held back quite a bit.
Okay.
You know, they're smiling, we kind of have to it, and then there's a real full, genuine smile, which is usually considered a lot better. Okay. So he kind of held back a bit. He was very self-conscious about how his teeth looked. So I said, "Well, maybe I can come up with a plan that we don't do surgery, we'll straighten you out." And we did that, and he was very happy. He came on some TV shows later on. I saw him on some of the shows, and it worked out great for him. His self-confidence
looks like those are veneers.
Jumped out.
So those are his own teeth.
Those are his own teeth. And that was a really great one for how it.
Does he give you any credit, by the way?
Of course he did.
It's all done. I mean, what does he say? What do they say?
That's great. I love it. I'm glad you did that for me. And they realize they're much better off.
Okay, good. It's excellent.
Well, here's another one, Randy. This young lady had a crossbite, was restricted to 2 teeth. Like her upper left front tooth was in behind the bottom left front tooth. And the pressure was pushing it forward. And if you let that persist, you can lose enough bone and gum tissue in front of that lower tooth to where you may even lose the tooth at an earlier age. But here she's a young girl, so it was good that the
So how old would you say she is, approximately?
I think she came in usually I think she was about 8 years old. Well, in her case, to let that, like some people think, "Oh, you don't do anything until all the baby teeth are out."
Because a parent, I mean, that looks
As
like
a parent.
By the way, that
she's
looks
a
like
cute
a nice
girl.
smile.
She has a nice smile. She has a
Right.
nice smile. However, as far as the damage to this lower tooth is concerned, earlier treatment is way better than letting it persist because you're going to lose some of the supporting tissue there. So much better to get that corrected as soon as possible.
Okay, so they bring them in, and this after, what is this? This is years later, obviously. She looks like a young woman.
Yes, that's after. So what we're talking about here is what we call 2-phase treatment, Randy. So it's 2 separate treatment times where you might do a first phase of treatment when the patient's as young as 4 or
Before
maybe
the
up to
permanent
10,
teeth come in.
while they still have a number of baby teeth present.
So that way the permanent teeth come in straight.
That's one of the big benefits.
Okay.
And then you deliberately perform some of the treatment at that age, knowing that later on you're going to have to do the rest of the treatment.
Okay.
So a lot of people have a misconception about that. They think you're doing the same thing twice, and they go, "Why do it twice?"
Good
It's
question.
a totally different thing. So the good analogy for that is to think that, okay, I'm taking a trip from where we are to ideal tooth thumb. So instead of taking it all later and maybe not having as good a result and one that doesn't last as well, you can do part of the trip earlier and you get to this point and you take the rest of the trip later. So that's kind of the good concept about what 2-phase treatment is.
Okay,
it's
so
two
with
distinct
her,
periods.
you start the second treatment when she's
Usually
12 years old or so?
Typical time would be 12 when the last baby teeth are in.
And then she's out of those by
Usually,
high school.
Usually before high school, they're done and it's over with, and they have this nice smile to go into high school with. Okay, now looking at this girl at the end of treatment, she's got this big, broad smile. It follows her lip line. It's just like this nice
It is very
Julia
nice.
Roberts type smile. When you see that smile, pretty much all the teeth are there and they're a nice line, big, broad smile. That's kind of our deal. Everybody can't be treated that way, but if we start with earlier treatment, a lot of the people can be treated keeping all the teeth instead of having to take some out later.
So 2-phase treatment, that means get them before their permanent teeth come in, and then you do it again, maybe revisit it 7th grade or 12 years old or so.
Yeah, like a normal situation would be we treat them, a typical one would be, Randy, we treat them like when they're 7 or 8 for a year to a year and a half. Then in my practice, I like to let them have free time between that treatment period and then a later treatment. So then we wait until...
Now we're just about out of time, but moving on to teen Invisalign and adult orthodontics, which is one of your specialties. What advice can you give parents, by looking, just self-examination or looking at your kids' mouths, what should you look for where you say, wow, for sure they should go in?
Well, one of the main conditions we like to treat early is what's called an anterior open bite, Randy. That means the mouth closes, the back teeth hit, but the front teeth can't bite all the way together. So here's an example of that condition. So this young lady had sucked her thumb, and even if she stopped sucking her thumb, she persists with what's called a tongue thrust. So you can think of it as a reverse swallow in most cases. So for this young lady, we put in a little orthodontic device that helped her train her tongue to stay back, and she was able to obtain a proper bite in the front after she worked on her swallowing. It's a big difference
right there.
It's a huge difference. And one of those, Randy, we really want to get them younger. And
what's that called? That's called an open bite when you see this?
Open bite, when they don't come together like that.
Is that common, by the way?
There are a lot of patients
all
like
over
that.
the place?
Yes.
What age do you see this coming in? Just young ones?
No, I've seen adults like that too, and they've had treatment even. I go, gosh, they complain. I had treatment, look at my teeth, nobody. I said, they ever treat your tongue thrust? And they go, what's that? It's like, wait a second.
Because not every orthodontist is the same.
True.
Right?
Yeah, we all have our
I know you want to say nice things about everybody, right? That's your personality. But, well, good for you. Okay, so what's another thing a
parent should look for is if they look at their child from the side and the lower jaw is back quite a bit.
Like maybe that's
a weak chin type look. Here's an individual here.
How does that have anything to do with teeth?
Well, what that means is the teeth don't match correctly. When you look at it, the upper front teeth are well out in front of the lower front teeth normally. So if you look at this young man, his lower jaw is back quite a bit.
So
it's
an overbite will create the chin to be back.
Well, actually, an overbite's a condition where the upper teeth bite vertically too far over the lower teeth. What we're talking about here is an overjet. So the teeth are jetting out away from the lower.
They're forward.
They're forward. So normally, like 81% of the time we see that, it's because the lower jaw is back too far. So we do have a treatment we can do where we bring the lower jaw so it matches properly with the upper. And so this young man had the treatment to bring his jaw forward while he's still developing the rest of his permanent teeth. And then we were able to get a nice proper
avoiding
result.
surgery.
No surgery, right.
Later on. We have talked, and I talked to another orthodontist. He said, Randy, there seems to be two schools of thought. Some old school, I'm quoting somebody else, by the way, old school orthodontists, they like to remove teeth to make room. It makes their job easier to straighten the teeth. And he said some dentists like to avoid removing teeth whenever possible. What is your stance on this?
Okay, now a lot of cases we can start treatment at an appropriate time, which is usually earlier. We can avoid having to remove teeth. So that's our goal.
So your goal is to avoid removing teeth?
If we can possibly keep them all, that's what we want to do, if they're going to look right. In some cases, that's not treating the patient properly, though. If the teeth are so crowded, they're sticking out of the mouth, then we have to do it. But we try to avoid as much as possible.
Teen Invisalign. I'm trying not to rush you here, but we are out of time.
Okay.
Teen Invisalign. Who's it for? Who's a candidate?
Teen Invisalign is a wonderful option for these patients that didn't get treated earlier for whatever reason, and now they're 15, 16. They don't want to have a bunch of braces on their teeth all the time. They want an option. And Teen Invisalign is great because
it's clear.
You use a clear plastic tray that snaps onto your teeth and causes a little bit of movement, and you go through a series of them and it gradually works your teeth into place. It's very comfortable. It's relatively invisible. It's a really nice option for a lot of the kids that don't want to have braces and want their teeth straight, get their smile improved.
So you have photos on your website they can take a look at,
yes,
etc. So moving on to adults, orthodontics. I guess it's becoming more and more popular, especially in this economy, because veneers can be very expensive. What are the categories of adults that you'd like to see more of in your practice?
Well, one big category is people who have never had treatment, and their lower front teeth have wound up going crooked on them as time goes by. What usually happens is the contact relationship breaks down a little bit, and one tooth starts going in or two teeth going in. That tends to get worse with time.
So the bottom teeth,
they start getting crowded up. There's pressure toward the front middle of the mouth, and once that slips contact, it's not going to get better. It's only going to get worse as time goes by. It can get really jumbled up in there. So it's much better to do something about it at the early stages of that condition than waiting until it's all crowded.
So what about the aesthetics? I mean, can you make braces not look so much like braces?
Absolutely, Randy. We have braces that are clear. The nicest ones are made of a synthetic sapphire crystal. Really great material, really firm, hard stuff. Doesn't stain. Beautiful looking braces. So that's a great option. And then, of course, we have Invisalign treatment. If we can do Invisalign treatment, that's even better for aesthetics. It's relatively invisible. So pretty much orthodontics, as we've talked about, is for any age. And just to summarize, the best thing is to bring a child in by age 7, get the information about what your child's likely to need. If they need something now, if they don't, they can go on a recall program. But at least then you're aware of the conditions. And you can't just rely on the dentist to do it, because a lot of times dentists will see the problem, but they don't know when it's best to do something about it.
So go to an orthodontist then.
See an orthodontist by age 7. That's the
by
best
age
plan.
7, go in. And is there a fee for that consultation for a 7-year-old to go
Most
in?
orthodontists don't charge for an initial exam on a new patient.
So if you bring in your 7-year-old to you, is there a charge for that consultation?
No, it's complimentary. We don't charge for an initial examination of a patient.
Okay,
We
that's
just
nice.
give the patient information and their parents information.
So if you don't like your crooked teeth, go in and do something.
Do something about it.
Do something about it. Now, are you set up for kids? Since you get a lot of kids?
Absolutely.
Because they've got to be afraid of the dentist.
You know, a lot of them are not. A lot of them are great patients. They tolerate things well. They get used to things quickly. Some of our best patients are the youngsters.
Anything fun in there to do for the kids?
Yeah, we have Kindle Fires they can play the games on and everything, and we try to entertain them. We try to be extra nice to them. All my staff are really good at dealing with kids, and we have people working in my office because we want them to be friendly and nice and warm and give the kids a good environment.
Okay, good for you. I want to thank you for coming on the show. Great information.
Well, thanks so much for inviting me.
I think
I've
we
enjoyed
learned a
it.
few things today, especially for parents that get in there early. Because they'll probably
orthodontic
save money
examination.
in the long run. And also, your kids don't have to be wearing braces in 7th, 8th, or even high school if you get in early.
Right. The best thing is
Avoid that.
Get them early and get them squared away before high school, and they're better off the rest of their lives.
All right, thanks again for coming on the show.
All right,
You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview online, we have it on our website. If you just caught a part of it, just visit wellnesshour.com and put in Dr. Alexander or Orthodontist San Diego. You'll find him that way. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.